Welcome to the True Skin Experts Podcast, your trusted source for clear, science-backed information on skin health and beauty. Presented by American Society for Dermatologic Surgery board-certified dermatologists, the episodes break down topics from skincare to medical dermatology and cosmetic procedures, so you can feel confident in your skin health decisions. Whether you're managing a skin condition, exploring cosmetic options, or just curious about the best skincare practices, we're here to empower you with expert advice, one episode at a time. Enjoy this episode recorded live at the 2025 ASDS Annual Meeting, showcasing the energy and innovation that make the dermatologic surgery community and ASDS members the true skin health and beauty experts.
Welcome to the ASDS True Skin Experts podcast series. In each episode, we invite you to join us to learn about skin health and beauty topics from the True Skin Experts ASDS board certified dermatologists. In this episode, we're going to talk about combination treatments and why multiple treatments can yield better results for our patients. Hi everyone, I'm Dr. Mara Weinstein. I'm a board certified dermatologist and an associate professor at the University of Rochester Medical Center in upstate New York. I'm also the director of cosmetics and laser dermatology. And now I'd like to introduce our special guest today.
Hi, I'm Shilpi Khetarpal. Thank you so much for having me. I practice at Cleveland Clinic where I run our cosmetic and laser center. I'm also an associate professor in dermatology and I'm really excited to be here today.
Yeah, thank you for being here.
I'm Rohit Kakar, and I'm also a board-certified dermatologist, and I practice cosmetic dermatology in Michigan and Indiana.
Wonderful. Well, let's jump right into it. So today we're talking all about combination therapies. And before we start, let's sort of just define what in your practice, what does a combination therapy look like in your practice, Dr. Khetarpal?
So I would say it's combining multiple modalities to give the best result. That could be a combination of medical therapies with then aesthetic therapies. It could be a combination of, multiple devices done at the same time. But basically, how can we deliver the best result, the safest way, and minimize downtime and optimize outcomes?
Absolutely. And do you have anything to add to that, Dr. Kakar?
I would agree with Dr. Khetarpal. In my practice, generally I'm combining medical treatments with cosmetic treatments, or I'm stacking multiple cosmetic treatments at the same time on the same visit, or I'm coordinating them so they occur at specific times.
Yeah. And I also find it's easier for the patients because they have taken out a chunk of time from their busy schedule and they're coming in and they really want to maximize that visit time. And I think when you explain to them how all of these treatments stacked work optimally together, it is a win-win, right? Because you're able to be more efficient in your office setting and they're able to maybe have a little more downtime, but reap the benefits of a better outcome with a shorter time up front.
I agree, especially when you're, like Dr. Khetarpal said, when we make safety first. That's
safety first, absolutely. Okay, so we're going to get into a few specific treatment topics, okay? And first, just because we all treat patients with hair loss here, I would love to know, Dr. Khetarpal, how do you combine treatments for your hair loss patients or for hair restoration?
So for hair, the way I explain it to patients, it's like pieces of a pie. The more things they do, the better their results are. We know hair loss is multifactorial, so we need to approach it with multifactorial treatments. It's a combination of, medicated shampoos, whether they're over the counter or prescription. Then it's adding in, supplements, whether that be vitamins, nutraceuticals. Then the, medical therapies like our oral prescription treatments, perhaps some topical serums, and then there's like the laser and light devices. So I kind of see it as let's address as much of that as we can, give it some time to work, and then other more invasive therapies, there's like PRP injections or hair transplant. It's kind of like climbing a ladder. We just add in kind of the lower rungs of the ladder, see how things go. If they're happy with it, great. If not, there's some other options we can do.
Okay, so in the office, your hair loss patient comes to you and they're like, I heard you're the expert in hair loss and I want you to do something today. So what will you do for them in the office? Like physically, I think patients want you to do something, right? It's more than just saying like, take this pill and use this cream. What will you do?
So, I think a good hair exam is really important because we can see a lot, is there inflammation? Is there scarring? What's going on in the scalp? Sometimes we can check blood work. They can, draw some blood, see what's going on internally because the hair is kind of manifesting what happens inside. If they're really eager, we can certainly do PRP right off the bat. It may not be my first option. I tell people it's going to take time to work, and if you do everything at the same time, we might need to commit to being on this long term. So I really let the patient guide what they want to do and what they're willing to do, but certainly there are times where, we'll examine the scalp, do PRP, check some labs, kind of do it all at once, and they usually have very good outcomes.
And how many treatments do you think of that sort would you counsel them on needing? Like how many, and when will they see results? You know, that's always if you didn't do it that way, what would the downside be to that?
So, I usually like to start with like the least invasive or simplest things first. And we know hair is on a little bit of a delay, so it takes about 3 months to see results.
Right.
So even if you start something day one, it's still going to take a few, weeks to months to see the outcome. So I like to kind of explain what our options are. It's almost like a menu. Like these are our options. There's pros and cons to each. Like what do you feel comfortable with, or what would you like to start?
Okay, great. Dr. Kakar, anything to add to that?
I tend to have a very similar approach, although I'll say it's a kitchen sink approach.
Yes.
And we need to do as much as possible.
Yes, I love
Hair
that.
is time. And so can we do as much as possible? And I'll explain that to them like Dr. Khetarpal was saying. But now I'll also mention that we need to give it 6 or 12 months before we see results. But in the office, in terms of what I can do, similarly, at the end of the day, we're physicians, and so we go with our physical exam first. I'll sometimes use dermoscopy as well,
Yes.
and that will aid me in the diagnosis, and I'll add in labs. But a lot of times, if the patient is willing and I'm ready to do it, I think we can really, get them to their goal. But just explain to them that takes time. It's
That's
not right
right.
away.
Yeah, absolutely. Yeah. I mean, I'm sure you've experienced this too, but patients come in and they say, I want PRP today, or I want exosomes, or I want a microneedling on my scalp. And I think, while we love to start that way, we really have to have that holistic conversation of like, this is not the only treatment
Correct.
for this condition.
I will literally say to patients, if you just do one thing, you may not get the results you want. So you have to understand that it's a combination approach.
That's right. Okay, awesome. Well, let's switch gears and let's talk a little bit about acne. So we all see acne patients, both with active acne and acne scarring. And I think you would agree with me that this is one of the hardest conditions to treat, especially when they have deeply pitted, ice pick, even boxcar type scars. So Dr. Kakar, what is your approach to acne scarring? And maybe tell us a little bit about what you do if they also have active acne.
So with your second question, typically if they have active acne, I'm starting by treating that and resolving that, whether that means medical treatments or more like something like Accutane, or if that means topical treatments, depending on the severity of their acne. And then I'll say there's a multitude of things we can do, from laser resurfacing to microneedling if they don't want anything as advanced, to filler. There's a multitude of things that we can do.
Sure. Okay. So you will or won't treat the patient with active acne for their scars?
I'll typically wait until we have
you'll
resolved.
do it together?
Yes.
Okay.
I'll say we need to resolve the acne, and then we can address your scars, because you can continue getting new scars at the same time.
Yeah.
But there are some medical treatments that do both, like for example, topical retinoids.
Absolutely. Okay. And have you ever used some of these newer devices that treat active acne and then also treat the scars, some of the 1726 nanometer lasers?
I have not had as much experience with that,
Okay.
but I've used more on the medical side of things before I attack our acne scars.
Okay. Nice. And then Dr. Khetarpal, what do you do in the office? Let's say it's a patient, no active acne, but they have deeply pitted scars. And they're like, I've been everywhere. I've had 10 resurfacing treatments and nothing worked. What would you do?
So I think a lot of it also depends on like skin type, because skin color we have to be a little more careful with. My general rule of thumb is like no active acne for about 6 weeks before we start treating the texture of the scars. Otherwise, we just kind of chase our tail. They get new acne, it gets a scar, leaves a scar. So, I think it's, again, a combination approach, but many times it's treating the color. I see the color as the lowest hanging fruit, whether that's redness, from the scars, or if it's post-inflammatory change and like someone darker. So I'll usually treat the color first and then treat the texture at the same time. I usually do a combination approach of, radiofrequency microneedling, ablative or non-ablative lasers, all at the same time, in addition to treating the color. So I like to really maximize the downtime and just the visit, and usually do 2 or 3 devices if we're aiming for color and texture.
Yeah, Dr. Kakar.
I was going to mention, she made a really good point with patients who are skin of color. what does scarring mean to them? Because a lot of times they'll refer to hyperpigmentation or post-inflammatory hyperpigmentation as scarring. And then we'll have a discussion about that and how we can attack that.
Right, absolutely. And sometimes that can be helped with just topicals
Exactly.
alone. Right?
And I think patients they're coming for acne or acne scarring, but like I think you could never undervalue the role of sun protection. You know, in fair skinned people, scars get more red, darker skinned people, they get more brown. So just educating them on like sun protection, even if it's not a sunny climate, that the environment can make things look a little worse.
Yeah, good
And
point.
another really good thing to discuss with patients of color is rosacea, because sometimes they don't really understand and it's not really addressed by other providers. So
Yes. Now, are you having the tinted sunscreen conversation with your patients with darker skin who are more prone to just pigmentation?
Yeah, I actually recommend for all my patients, regardless of skin type or what we're treating, the tinted sunscreens, because with that iron oxide in it, you know, we're on our phones and computers all the time. We know it can dull the skin, age us, in addition to causing pigmentary changes. So if they are going to use it, I tell them just buy a tinted one. Do yourself a favor, you know, you'll save yourself some time and energy and just keep your skin looking fresh.
Looking fresh, right?
Yeah.
So iron oxide is a wonderful ingredient. It's an inactive ingredient in tinted sunscreens. And we know that it blocks visible light and blue light sources, which is the light we're getting, like ambient light we're getting all the time. And that type of light has been shown to increase pigmentation on the skin, especially in darker skin tones. So it is essential, and I think we'll agree that if you're having issues with pigmentation, that you do offer a tinted sunscreen. So for my acne patients, I usually do a 3 combination therapy approach. Obviously, it's different for everybody, but in general, I like to treat the deeply pitted scars with TCA Cross. So that's a high concentration of TCA, which is trichloroacetic acid. And then we'll do some subcision the same day. So that's to release those adhesions that create that bound down appearance of the scars. And we'll top it off with a non-ablative or a hybrid fractionated laser device. And I found that that combination has really cut down our treatment sessions has really cut down our treatment sessions about half. And so while maybe they needed like 6 to 8 treatments to help with their scarring, now we're down to 3 to 4. So that's just an example of some combination treatments where we're using a little bit of peeling, some manual labor with the subcision, and then our devices.
do you ever combine any HA filler with any acne scar that's remaining?
So that's a great point. I do think that even with the combination approaches when talking about acne scars, it's never 100%, right? And so typically they come back and maybe there's still some textural changes. They're just not as pronounced. So for those rolling scars, I'll put in a little bit of HA filler.
I do the same.
Yeah,
I do this.
So
It's
I
like
think
the icing on the cake.
the icing on the cake. And patients love that because you can just put a little drop and it makes a world of difference. Let's talk about anti-aging treatments and how you suggest combination treatments for, a patient who comes in who just wants to have less wrinkles, less textural changes, less photo damage. What do you do for them?
So I go back to the basics, the 4 R's, which is relax, refill, resurface, and redrape. And many times we will do it all at the same time. Depending on the age of the patient and, ethnicity and sun protection, genetics will determine how many of those they need. So, many times relaxing the upper facial muscles, fine lines, we'll use, neurotoxin in the upper face, refill using, HA fillers, biostimulators to give that volume back, resurface with, ablative, non-ablative lasers, and then if they need it, redraping. I do a lot of non-invasive skin tightening. So just picking the order based on what they need, we kind of determine, but we can certainly do all of that on the same day if the patient is willing. And it is a few hours, but it's definitely maximizing things, and we're able to do it safely. So
How do you wrap in the skin tightening with that? Because there is some controversy over, injecting filler and then using a heat-based device. So what order, how do you have that conversation with patients?
So I think a lot of it goes to, just personal experience and the side effects or lack thereof we've seen. So I usually start with so we numb them first. Then we start with the filler.
Okay.
Then we do the skin tightening, then the resurfacing, and then the toxin last.
Okay. So filler first and then tightening.
Yeah.
Wonderful. I do think that after tightening, there's a little bit of swelling, so it obscures the true anatomy of the face. And so it's hard to fill if you can't appreciate the true anatomy and facial structure.
Absolutely. I think, and with toxin, I always mark first because they're a little red and swollen from the resurfacing, just to know the landmarks or like how many units we might need. So.
Absolutely. And Dr. Kakar, what do you do?
I tend to do the same thing, although I have not heard of that acronym. Relax, refill, resurface. And what was the last
Redrape.
one? Redrape. I've not heard that, but I tend to have the same approach.
Right.
And sometimes you can time them at the so that the patient's getting the best results. For example, if you're doing CO2 laser, and you'll knock out their musculature with neurotoxin prior to their treatment, so that they get the best results possible. So I tend to do the same thing that Dr. does.
And with that type of combo treatment same day, what sort of downtime are we looking at? If you're combining tightening, resurfacing, filling, and toxin, how are you counseling your patients after that?
So I'll discuss that this is a longer term approach. And so we need to, some things are not everything, we can't do everything at the same time. So we'll parse them out. And so maybe neuromodulators first, because I don't want to do them on the same day as maybe perhaps a procedure in the exact same area. So it just all depends on what the patient's seeking and what area we're treating.
Okay, so you will sort of parse them out?
I'll parse them out.
Okay.
But I'll say maybe we'll do this in 2 weeks, or maybe we'll do this in 3 weeks, depending on the patient.
Okay.
When I do them together, I think resurfacing is the limiting factor. The other treatments, besides like a bruise or mild swelling, there's not real downtime. So I think the resurfacing, it's like, 5 to 7 days.
Yeah.
But I don't think adding the other modalities increases the downtime or discomfort.
Right. So, okay.
How do you do things in your practice for combining like anti-aging treatments?
Yeah, so recently, so I'm in upstate New York, so we definitely have, in my opinion, a laser season. And so a lot of patients who come to upstate New York in the summer because they live in Florida in the winter want treatments during what's like off season. So I hate to describe it that way, but we've sort of modified our combination treatment protocol to include a light IPL followed by a resurfacing treatment. So that way we're lifting some of the brown superficially, collapsing blood vessels, and then adding the resurfacing in the same day. And post that treatment combo, we'll inject a little neuromodulator. And then I would do lips for dermal fillers. But if they needed other structural fillers like jawline or malar cheeks, I would have them come back. But we love combining the IPL with like a low level, low downtime laser. So this would be the 1927 nanometer diode laser that we combine it with. And that's been sort of a modified approach versus one of the bigger gun resurfacing lasers. Yeah. And we just have a few minutes left, so we're going to wrap up our conversation with combination treatment approaches for dark spots and conditions like melasma. So Dr. Kakar, what do you do? Patient comes in, it's the middle of the summer, and they've got a face full of melasma.
So depending on their skin type, we'll have a conversation about sunscreen, like we just mentioned earlier, about iron oxides and mineral sunscreen. So we'll have that discussion. And then I'll ask them about generally I'll ask how risk averse they are, how motivated they are, and how risk averse they are.
That's important.
Because that's a conversation that needs to be had, especially when I tend to prescribe like oral tranexamic acid, or if they want a resurfacing procedure, which you have to be careful about in melasma, or if they just want something like a chemical peel. So we'll have that conversation, but I'll give them the options depending on sort of what their goals are.
Yes. Okay. That's important to know. So tell us a little bit, just for our audience, what is tranexamic acid and why would that be appropriate for our melasma patients?
So it's a medication that we can prescribe and really helps with pigmentation. And so it's off-label use, and we typically divide it BID dosing, but there are some risks associated with it. So you have to have that conversation with that patient, with like thromboembolism, for example.
And in my mind, it's more like a summertime short-term treatment. And so it's a nice add-on to your topicals and chemical peels and things for the summer.
And it works really well.
Yes, yeah. Very nice. Dr. Khetarpal, what are you doing? Anything different, anything to add for that?
The only thing I would add, I think, the tinted mineral sunscreens are great. Maybe adding in a topical antioxidant. We know that can help with some of the pigment. I generally start with topicals first. A lot of the compounded topicals, some of them have hydroquinone, fruit acids like kojic acid. niacinamide, some of those, and then kind of lift as much pigment as we can with the topicals, then oral tranexamic acid for whatever's left, and then if there's anything left, sometimes a very, very light resurfacing laser, like the 1927 thulium.
Yes.
And then every summer we're kind of back to the oral medications if it's appropriate. But I explain to patients, we can't cure it. We're putting it in remission, and it is going to flare in the summer months, no matter how careful you are with sun protection or sun avoidance. So I just prepare them for that in advance. Whatever improvement we get, there's a chance it might come back.
Right?
I was going to mention the counseling is really important with melasma patients. Not being near heat, not being in the sun. A hat is not enough. Having that conversation with them. So don't put your phone on your face. I mean, I will literally tell patients this.
Yes, yeah. And just to wrap that up, I think it's important just to state that for melasma, the first line of treatment is really topicals, right? So a lot of patients come in and they say, I want you to laser this off my face. And you're like, wait, back up, let's slow down. Right, and so say first line of treatment for melasma is topicals, and then we can and oral medication. Then we can get into peeling, and then last resort would be lasers. And so the combination approach would look like a combination of all of those, but keeping in mind there is an order that's specific to melasma. Thank you so much for joining us. As you've seen and heard, healthy skin is never one size fits all, and that's why it's so important to turn to a board-certified dermatologist for true, reliable, science-backed information to take the best care of your skin.
Thanks for tuning in to the True Skin Experts podcast. If you found today's episode helpful, be sure to subscribe and share with someone who might benefit. For more resources, or to find an ASDS board-certified dermatologist near you, visit asds.net and follow at ASDS SkinMD on all social media platforms. Until next time, take care of your skin. It's with you for a lifetime.